Hello, my fellow ortho enthusiasts, and welcome to the Seaview OrthoPod, where we cover everything orthopedics to get you back to quality living. I am your host, Layla Jabbar, and you are joining us for episode 4, where we will be discussing soccer with the pros, knee injuries, treatments, recoveries from the point of view of player, coach, trainer, surgeon, and physical therapist. Today, we are joined by Dr. Sunil Thacker, John Galluci Jr., and Tab Ramos. From Seaview Orthopedics, Dr. Thacker is a board-certified, fellowship-trained orthopedic surgeon specializing in sports medicine. He has been involved with the care of numerous professional NFL, MLB, NHL, PGA, UFC, and NBA athletes, including members of the Philadelphia Eagles, Flyers, Kicks, and Phillies, as well as collegiate athletes from the University of Delaware and Rowan University. He has been awarded with the title of New Jersey Top Doc for the last 9 years. John Galluci Jr. is the president and CEO of JAG-ONE Physical Therapy, a noted author, and an Ernst & Young Entrepreneur of the Year award winner. John is currently the medical coordinator for Major League Soccer and is the former head athletic trainer of the New York Red Bulls MLS team. John is a sports medicine consultant for professional athletes in the NHL, NFL, NBA, MLB, and U.S. wrestling, and was named among ROI NJ Top 20 Healthcare Influencers of 2021. Tab Ramos is not only one of the greatest U.S. national team players of all time, but he is also the first player to sign a contract with Major League Soccer clubs. After retiring from professional soccer, Tab founded a U.S. Soccer Development Academy club in New Jersey, and he coached the U.S. Under-20 national team from 2011 to 2019, reaching 4 FIFA Under-20 World Cup tournaments. He was inducted into the U.S. Soccer Hall of Fame in 2005, and most recently, he was the head coach of the Houston Dynamo FC in the MLS.
Well, I want to thank all of you guys for being here today. I appreciate you taking the time out of your busy schedules. There's not many people that I'm a bigger fan of than myself, and you can ask anybody here, but both of you guys are on my radar screen as far as that goes, and I've looked up to Tab forever. John, just through working with him over the years and with Jag-ONE, we've had a great experience and gotten a lot of players back to ship shape, and it does take an effort of everybody involved. It's not just an injury and then the doctor takes care of it. There's a lot of background stuff that goes on to make sure that guy gets healthy. So I appreciate all you guys being here today. Thank you.
Yes, thank you guys so much. So 2022 is here, and we all know it is a FIFA World Cup year, so super excited for that. As all the players gear up for the games of a lifetime, I'm sure injury prevention is in the forefront of their minds, as we still have what I believe is 272 days before FIFA kicks off. Soccer, like most other sports, puts you at risk for injury. We know this. Most soccer injuries involve the lower parts of your body, mainly the ankles, legs, and injuries come from overuse, landing incorrectly, and sudden movements, or even an encounter with another player. So, Tab, we're starting with the pro. In your years as a player, did you ever personally face a knee injury? If so, if you could tell us a little bit about what it was and how long it took you to get back to the field.
Okay. First of all, thank you so much for having me on. It's my pleasure to be here. I had a pretty long career in which I had many knee injuries. I had 2 ACLs, so let's just call those the most difficult ones to come back from. But like Doc just said, it's it takes a team. It takes a team to get somebody better, and it's a process. And as long as you follow the process and you're dedicated to the process, there's no reason why an athlete couldn't come back 100%.
I have to ask, of the ACL injuries, can you tell us a little bit about how one of them happened?
Yeah, one of them was just I was playing a World Cup qualifier just on a sprint, second half, about 20 minutes left in the game, so a little bit tired, playing in Trinidad and Tobago, which is a very hard surface, and I reached for a ball over a defender, and when I landed, my knee buckled, and I felt right away, the sting, in the knee, and we knew right away that it was something serious. That was my first one. So yeah, it can happen in a split second, and it can happen, and it's sometimes it's hard to believe all the different movements that we make when we play and the strain that we put on our knees. And sometimes it could be the slightest movement that could tear a ligament in the knee. And that was at that point, it was really disappointing.
Oh my gosh, I'm sure. Absolutely. And I'm sure even from a coaching standpoint, when you see your players and the knee injuries, I'm sure right away when they go down, it's something serious.
Yeah, that's one thing that as a coach, I take the experience that I had as a player, and it comes in quite handy. As I'm sure you guys are much, better experts than I am at this. But I can tell a lot of the time when a player goes down what the injury is almost right away. And you can tell if it's serious. Of course, it's not 100%, but you get a pretty good idea from the way a player can go down. You get a pretty good idea on what the injury is going to be.
For sure. And John, in your experience, as a trainer for professional soccer teams, what is the most common knee injury that you saw on the field?
So, most common, you see a tremendous amount of meniscus tears, but of course we see our share of ACLs tremendously throughout all of soccer, collision and non-collision ACLs. First and foremost, thank you again for inviting me and Tab on the show. But in soccer, professional soccer, recreational soccer, club soccer, collegiate soccer, high school soccer, I would say the highest incident is definitely meniscus tears based on the rotary component in the sport. But ACLs is very, very prominent throughout. And being a physical therapist and athletic trainer, I've had the opportunity from being on field, from onset to post-surgical rehabilitation, and then return to play back onto the field. So after someone as great as Dr. Thacker does an ACL repair, it's very important that me as the athletic trainer from the onset communicates with Dr. Thacker, and then ultimately together and collaboratively with the athlete, the coach of the athlete, and the parents of the athlete. We work collaboratively to get that athlete back on the field in tip-top shape. So it's not just the rehabilitation of the knee, as Tab will tell you, it's really getting back to what we call player ready or game ready. And a lot of people miss that in sports. Everybody thinks that the normalcy is, can you walk up and down the stairs with no pain? Well, as Tab will tell you, playing soccer is definitely a whole other level. And you not only have to have a strong component of your lower extremity, you need to make sure your core, your endurance, your level of fitness is there before return to play. Otherwise, you can sustain a secondary injury and end up being out longer.
For sure. Dr. Thacker, I'm sure you can agree with a lot of that. And, from a surgeon standpoint, when a soccer player comes in, what injuries are you most commonly seeing?
I would agree. I mean, we see everything from metatarsal fractures in the foot. You'll see a lot of times, and the higher level players can do things without a lot more times without contact because of the fact that their strength and their abilities are so high that you can just plant, and because you're so powerful, you can pivot off of that foot. And depending on the type of turf that you're playing on, or the field conditions, the weather, whether or not it's wet and slick on a turf field, and all of a sudden you start slipping a little bit, depending on the things like the cleats that you're wearing and how deep the cleats are, those all play into getting injuries. And I agree 100% with John as far as everybody being on the same team. We know the injuries that are there. The physical therapists who have been in the game and deal with sports medicine for a long time understand what the recoveries take. And we've gone years ago, went to a much more functional based recovery for athletes, because there are people who put in the time every day, and at the pro level you're in the training room for hours and hours and hours every day trying to rehab from an injury like that, whereas the guy who plays recreational soccer might go to therapy 3 times a week, and that recovery is going to be a lot slower than the guy who's putting in 8 hours a day. Granted, they might have different gains as far as where they want to get at the highest level versus just going back to recreational soccer. But the core strength thing is one of the biggest things. I think that's the thing that everybody misses. And you get these great kids that are coming out at development level that are phenomenal athletes, and maybe they're a little undersized. And where they pay for that is there's growth spurt ages, that 10 to 14 age, where you got the 12-year-old kid who looks like he just came in there on his motorcycle with his 3 kids on the back. And you got the 12-year-old who looks like he's 8. And they've tried to adjust some of the rules with youth soccer to try and equate that. I think a lot of it goes by age, and there's reasons that it has to stay within certain boundaries, but they've definitely tried to help by getting some of the size differential and skill level differential. I think that's one of the other things that comes into play. But yeah, I would say any kind of pivoting sport, so soccer being one of the most pivoting of all of them, when you have to juke another player and you have to plant and you have to move your feet that quick and you can't get them up on time and somebody else is coming in a little late on the tackle, and the next thing you know, everybody's legs are getting wrapped up. So for a guy like Tab to be successful, it's not just to have that skill level, it's to have that skill level to be able to avoid major injuries throughout your coming up in the career, and then to be able to get past the injuries that you have. I mean, it's when they say it's 1 in a million people that would get to the pro level, there's a reason for that. It's not because the 1 in a million have the skill. More than that have the skill, but along the way, there's going to be pitfalls, and you have to be able to recover from them.
So yes, Dr. Thacker definitely just touched on my next question. So I kind of want to field this question to everybody, no pun intended. But why do we think knee injuries are so common in soccer? I know you just mentioned a lot of the leg tangling, pivoting, but I'd love to hear, from all of your perspectives, why we think soccer specifically ends up in so many knee injuries.
I think Tab should take that one. I think that's especially looking at players every day. Shoot it.
Yeah, well, I mean, I think, it's actually, it's a good question, but I think that the most important thing is that it's the uncertainty of where you're going to land when you land. Whenever it's not so much the force with which you play, because when you're cutting, you're sure of where you're cutting. It's more when you're off balance. It's more when you're unsure. It's more when you get tackled and you don't know where you're going to land. And I think those are the difficult moments. You rarely see a player just getting a knee injury by cutting, because of cutting, it's all predictable movement and you're prepared for that. As John was saying, whenever you have an injury, there's a team helping you to recover. And when you recover, you usually come back stronger than when you were playing in the first place. So you're ready for all the movements, but you can't be ready for something that's unpredictable. And those are the moments that are really dangerous in soccer. And they happen all the time because the game is a constant flow. It's constantly moving. There's no 2 plays alike. So you can't predict what's going to happen next. And you can only prepare as much as you can, considering that you don't know what's going to happen. So I think, I think those uncertain moments where you don't know where you're landing, those are the difficult ones. And most of the knee injuries occur.
I think it's important to note too, that soccer is a world game and it's played at every level. It's played from children, club, school, academy. So professionals, and Tab could probably definitely weigh in on this, have a full team. So if you look at our programs at Major League Soccer, there's physical therapists, athletic trainers, nutritionists, physicians, primary care, all around the team consistently for the care of musculoskeletal injuries in general. And when you look at athletes from the collegiate down, they don't have that huge network of medical professionals similar to myself and Dr. Thacker consistently around them and working collaboratively with them. So ultimately what happens is a lot of your lower extremity injuries, a lot of your strains, your sprains are really caused by not being ready for the demand of the sport. And Tab, who's played something his entire life, will tell you every level he's played, he could probably pick out the athletes he went against that probably were not at a fitness level to compete, probably sustain an injury because of levels of fitness. We see it each and every day in every level of sport that if you're not ready for the demands of sport, and then Dr. Thacker and I in our practices probably see each and every day, when do you see the largest incident of injury? you see that largest incident of injury in preseason, because most youth athletes are not coached for a preseason. Then they come in for this so-called 2 or 3 week conditioning, and the coaches ramp them up to 100 to 110% on day 2. And then all of a sudden you have 20% of your squad seeing me and Dr. Thacker. So I think it's important that the messaging out to the community, especially with a pro like Tab that's played at every level and coached now at every level, especially in a developmental component with the U.S. national program, understand that it's important that you need to prepare for any sport, not just soccer, but the demands of the sport. As Dr. Thacker pushed out, it's very, very important that people understand the pliability, the functionality, the biomechanics, the endurance, the strength. Do you know how many injuries that we probably see a week in our facilities for people that don't know how to hydrate and sleep and train appropriately? So I think there's a lot to be said on that, not just on the ACL, but in musculoskeletal injuries in general with soccer.
Absolutely.
I agree. I think like you touched on nutrition. I think that's one of the things that goes by the wayside, and yet probably one of the more important things. I used to tell my son played at a higher level. I'm saying high level with you guys, so I'm going to say my son played at a lower level, and you realize that, like, I would tell him we were playing in the middle of July and it'll be 110 degrees. And I'm like, the night before, you got to drink. Those liquid cells need to be liquefied before you go to bed. If you're trying to drink water a half an hour before the game and you're expecting not to get a cramp, and when it's 110 degrees outside, you're out of your mind. Like, those things take time for your body to process, and little things like that go by the wayside and lead to injuries. And it's interesting because Tab said that he got hurt in the later part of the game. And that's another thing that happens. Like, if you're not conditioned right, maybe you're good for the first half, and by the time you're tired for the second half, when you go to make that move, all of a sudden you don't have 100% anymore. You're at 90%. And if you look at how much these pro soccer players run in a game, I mean, now they can calculate all that stuff on it gives you, like, when the guy comes off the field, he ran 7.5 kilometers today. Okay, like that's during a game, like might have played 35 minutes in the game. That's a lot of running that you're doing, sprint, stop. Those people don't realize how much that is. I think that like things like the Fitbit and stuff like that have helped us to understand how many steps we take in a day. But in reality, like, now there's more advanced apps to show you how much you actually run, how much like mileage you've covered. And it is very important to be conditioned right for the level that you're playing.
You guys make really great points. And actually, in one of our previous episodes, we talked about, younger kids in sports, and we talked about how high schools per se are putting a much more heavy importance on like dynamic stretching, and how important that is to the prevention of injury. And in soccer, like Tab said, with knee injuries, you're not always going to be able to prevent it. There's a lot of times you don't know how you're going to land, or you don't know when that collision is going to happen. But, the younger sports are putting a heavy importance on that stretching and concussion prevention. Is there a way that, whether it's a young kid or a professional athlete, can prevent some of these knee injuries?
Well, there's a bit.
What Dr. Thacker said is maybe Tab could share a little bit at the U.S. national level and also at the pro level, how much technology is involved in the conditioning and the strategy of working as a coach with the players. I don't know, Tab, if you want to expand on that at all.
Yeah, I mean, the prevention part is takes up most of the players' day. When a professional team comes into training in the morning, they have a good solid hour of going through different kinds of movements and strengthening exercises according to what they need. And that's whether somebody may have a weaker hamstring, or somebody may have a weaker calf or a bad ankle or a issue with a knee. Everyone is preparing for whatever their weakest area in their body is. And the preparation with the high performance department is huge. It's the biggest part of actually being a pro. The training session sometimes can be 40 minutes, sometimes can be an hour 15, but the preparation before and the strengthening after play the biggest roles to get you prepared for games, more than the actual training sessions.
I think I've seen too at the high school level, a lot of coaches have gone by the wayside with with what we used to do, just the 10-minute stretch kind of warm up thing that for some reason has lost a lot of momentum and the coaches just get the kids right out and start them playing. I think that's one of the worst things you could do, especially when there's temperature issues. If it's freezing cold outside, you're going to pull something if you're not warmed up. If you're, maybe you can get away with it to some level when you're younger. Definitely once you start getting into college years and beyond that, you need to be able to stretch. And I think that's one thing that everybody forgets. I mean, if we deal with that in casting all the time. You're trying to clear somebody to play. They just came out of the cast and they can barely move their wrist. Okay, well, the bone's healed. But you know what? If you were to fall down right now and your wrist was to go back the normal amount, your wrist can't do that. You just came out of a cast. So now all of a sudden, if your wrist gets pushed back to the normal level, you're going to stress something and you might even refracture the bone. So flexibility plays a big thing in it. I think that's something that people lose sight of. I think what Tab was touching on, there's a lot of parents who think their kids are the best thing in the world. We all think our kids are amazing. And some parents take it to the next level and think their kid's going to be the next Tab Ramos. So they are going to put them in 3 different leagues, where maybe the better thing to do would be to put them in a physical therapy type performance program where they actually work with a therapist on correct mechanics, so that when they are playing, they are not doing things incorrectly that are setting themselves up for an injury.
Absolutely. These are great points, guys. Thank you. And I played soccer, obviously not on the professional or even collegiate level, but I played for 15 plus years myself. And I experienced a lot of overuse injuries. Thankfully, never a knee injury, but I had shin splints, groin pulls, Achilles tendonitis. Do these types of soccer injuries have long-term effects as an adult? Because it's harder and harder to get up in the morning out of that bed. I'm sure a lot of professional athletes feel a lot worse than I do, but...
I can attest to that.
Yeah, go.
It's really hard to get up in the morning. It's difficult, after a lot of surgeries and a lot of years of having played, I run 3 miles every day. I try to stay as fit as I can and I enjoy it. But if I didn't do it for 2 or 3 days in a row, I'd have a tough time moving around. I feel like I need to keep moving. Both of my knees, I'm at a point where I can't bend them all the way back. They only go to a certain place and then I can't bend them all the way back. Fortunately, I have good extension on both, which is the one thing that's like ingrained in the back of my, brain from John Galluci telling me that, extension is so important when you do ACL. Extension. You always should have it, So my extension's good. But
that's the only thing I ingrained in your head. That was it. It's all just extension. So I think Tab just touched on something very important, and I want to make sure that we highlight it is the body's made to move. And although you may have had injuries, you may have had surgeries, you may have gone through rehab, the most important thing for the body is to keep it moving. The body is made to locomote. It's made to function within ranges of motion, and ultimately between proper nutrition, hydration, and exercise, it's very important. As you can imagine, Tab is probably, if you look at the athletes I've treated over the years, probably closest to my age. But ultimately, he might even be a little bit older than me. I'm not sure. But if you look at the athlete and you look at the timeline of the athletes and when they recover, as they get into their 40s and 50s, a lot of athletes will stop. And when you have that injury, you might have rehabbed and you don't take care of your body like anybody. You don't have to be an athlete. You start to lose general conditioning. And it's so important for us today to get a message across that it's not just about injuries, it's about the utilization of your body and the function. I mean, the healthier your heart, the healthier you are. The more you move, The more the joints move, the more lubricated they are, the more the musculoskeletal system works and functions correctly. So I've actually taken athletes, and I don't want to say older athletes, I'll say wiser athletes, that all of a sudden after play stopped doing everything. And then they come and see me 10 years later and they're in severe pain. They have severe quad pain because they went out and played a game of soccer and they didn't play in 2 years. Well, ultimately, you put them on a conditioning program for 3 to 4 weeks and they're like, oh, you're a miracle worker. No, I made you do what your body was made to do, which is move. So with Tab said that he's functioning each and every day and doing aerobic activity, but also making his body move is probably the most important thing that Dr. Thacker and I can get out to the community. You have to move or you get stiff, you get sore. Soreness is not an indication of an injury. It's an indication you're not moving. So you need to move.
Yeah, and I think we see that more with jobs that are more and more jobs that are computer based, where you're sitting at desks, where people have started to do things remotely now. And even maybe your commute into the city stopped. Like for those of us who live in New Jersey, like I know I can barely get a tea time anymore because everybody's working from home now, and they're all playing golf 6 days a week. And, you know, but now they're sitting at home, they're sitting at their desk, and I'm seeing a lot more neck things, stiffness. I'm seeing a lot more just postural issues that are coming up from people just sitting around. And like, I don't know how much Candy Crush anybody can play in a day, but apparently it's a lot, enough to cause you to round your shoulders all the time. So I think that's absolutely true. And you see the guys, I mean, Tab's in better shape than I will ever be in. So the fact that he is living the quality of life that he is at his young, I'm going to say young age, because like he's clearly younger than me. I don't know, John, you know, you're going to start throwing down some gauntlets over here with accusing him of being older than you. But we see it, and from the medical standpoint, because 100 people come through my office every week, and you see the ones that are 50 years old that have taken care of themselves all the time, and you see the ones that are 50 years old that are a mess and just overweight and just don't have any flexibility and don't have any strength, and it's an effort for them to get out of a chair. And the people who are taking care of themselves throughout life are going to get a lot more value out of their bodies than the people who are really abusing their bodies, if you want to call it that, or not using them for what they're meant for.
Absolutely. This is my final question, but I think it's a very important one. And John's touched on it a few times, and so has Dr. Thacker. But, you know, from all standpoints that we have here on this podcast right now, inexperience, rehabbing a soccer injury or really any sport-related injury, how important is collaboration from all levels to getting somebody back to the field and consulting with your physician, and then the physician taking the proper course of action for that patient, and physical therapists and even the coaches making sure that they're following or being compliant with the plan? How important is this collaboration?
So I'll take it to a component only because I do a tremendous amount of educating to coaches and communities. And if you look here in New Jersey, the Athletic Training Association in New Jersey and the Director of Athletics Association actually bring me in to speak about how to treat youth athletes and how to treat high school athletes. And one of the biggest things is I have a chart that I show this teamwork approach. And the athlete is in the middle. And it's important that the athlete, especially with an injury, is communicating consistently with his athletic trainer, physical therapist, parents, coach, physician, and making sure the performance component and return to play, let it be a physical therapist or a strength and conditioning coach, working collaboratively, that teamwork approach is constant. And that's something that I push very, very hard throughout the associations here in New Jersey. And it's very, very important. If you look at someone like Tab that's played at every level, I think Tab could probably comment that everywhere that he's gone, and I'm sure at times agents and wives might have gotten involved and parents, but I'm sure
Wives getting involved in that stuff? Sounds so ridiculous.
I'm sure Tab can expand on the teamwork approach at the pro level.
Yeah, I mean, there's a lot of factors to it. In particular, when you're talking about, you know, let's take an athlete, for example, that's in high school, that's on the verge of hoping to get a scholarship somewhere. and he gets injured, and now he's got some big games coming up, but the high school season will be over in a month. And now you have the pressure of getting them back, and now you have the parents putting the pressure to getting them back. And the pros is exactly the same, but there's a lot more components to it. Is that player going to be out of contract at the end of the year? So the agent is calling you. Is the coach going to be out of a job at the end of the year? Does the coach need him next week or this week? Or is the coach willing to take a chance on the player being injured longer? So not always on every team and in every circumstance is, when you talk about that team and that circle of people with the athlete in the middle, I think the answer is not always what the best answer would be for a long-term recovery of the player. Sometimes you need the player now, and sometimes you have to be willing to take a chance that the injury can get worse. And I know that's not something that people like to hear sometimes, but this is stuff that happens in the pros all the time. There's a game that you have to win. There's people getting fired. There's a lot at stake from week to week, and you need the athletes on the field now, not 2 weeks from now. And all those factors can, add pressure. So whether it is, John was saying the parents or, the wives or whatever, but, this is the case. It's how it works. You have the agent, you have the technical director of the club, you have the owner of the team who may have paid tons of money for a player and he doesn't see him on the field. You have the coach who's playing for his job. There's so many other factors that lead into the speed in which you have to help the player recover. So I'm not, so I'm sure that doesn't help from a medical standpoint. I'm sure the answer is only one. You have to go the safest way to get the athlete back so the athlete's back 100%. Well, that sounds like a beautiful ending to a beautiful movie, but that's not always the way it works.
No, I agree. I mean, like I said, I'll give you instances, and we were talking about meniscus being one of the biggest, or most common injuries. So we had this UPenn football player, University of Pennsylvania, Ivy League school. Kids are good. They don't usually get at the Ivy League. They don't give athletic scholarships, and so most of these kids are undersized. Every once in a while, you'll hear about somebody going to the NFL from Harvard. Fitzpatrick, the quarterback from Harvard, went there. But most of those are kids that are there because they're academically strong and they're playing football because they were good. Their likelihood of them going to the next level is pretty small. So we had a kid who was a sophomore at UPenn, and he tore his meniscus, and it was 4 weeks before the end of the season. Now the parents he has a fixable meniscus tear. Now if I fix it, it's going to be 6 weeks of protection and then another few weeks to get him back to strength and range of motion back. So you're at 10 weeks, but now he has his whole meniscus, and the prevention of arthritis throughout his life is now down to the normal. If you take out that piece of meniscus, if it's fixable, chances are it's at the periphery, which means you're taking a huge piece of it out. And the more you take out, exponentially faster is the development of arthritis. And so the parents want him to play football and get back before the end of the season. Now, if I just take that piece out, it's a couple of weeks. He can probably play somewhat in a week, and probably in 2 weeks, he's doing most things. By 3, he's close to 100%. But in the long term, for a kid who's 19 years old to take out most of his meniscus is really not the right decision. But again, those factors come into play with what Tab was saying. Like this, maybe this is what if it's not? Let's take him out of UPenn and put him at Nebraska, and now it's his senior year and he's going into the draft next year. Well, now all of a sudden it's different conditions. Now all of a sudden there's different factors. So that I wish that it was that simple, Tab. I wish that there was only one answer for every solution. But I think sometimes it's the thing that is not the right thing according to the book. And my job as a physician is to tell you what the consequences of what your decisions are, and to tell you what the long-term and short-term consequences are, and then to give you the pros and cons of the options that you have, and then we will work on that together. And the more people you have in your camp, as far as agents, as far as general managers, owners, and that stuff, the more complicated it gets, because the more people that are putting their opinion in on what's the best thing, and everybody is looking out for what their version of what the best thing is for you. That's not necessarily the best thing for the actual player, and that is where it's the water gets muddy.
The one thing I would add to that is, and as I found out in MLS in particular, but it applies, I think, in all cases to all different levels, is regardless of how many people become part of making decisions on, how quickly someone's going to come back or what the treatment's going to be. I think the most important thing for the athlete is to decide that there's one person running point on the medical side. Because what happens sometimes in a league like MLS, and I assume it happens in other professional leagues as well, when you have players coming from other foreign countries and you have a medical team within the club that you're playing for, those players sometimes, if they don't feel like they're recovering quickly enough, their agents normally have them talking to someone outside the country, and now they're following a couple different protocols. And now it becomes a mess. So I think the important part is to always follow one person on the medical side, regardless of what the expectations are, that somebody needs to be the point person.
Agreed. The other thing before we close, we have to start to think about too, and Dr. Thacker and I each and every day are teaching athletes from the club level, the collegiate level, the high school level. And ultimately, we're in a position with the new NCAA rule change that we're going to be seeing agents at a much earlier age than just the professional level. Just this year alone, we've had high school athletes that have sustained injuries. And although they're not contracted by an agent, the parents have in the back of their head that they're about to be a freshman in college and about to sign an agent. So that's changing a component of agents being involved in a much, much earlier level when it comes to athletes, injuries, communication, and ultimately pressure on the athlete to perform and get better quicker instead of getting better healthier. And I think that's something that Dr. Thacker and I are going to have to combat. Maybe we could do a whole show on that down the road, but it's definitely something that we're starting to see in our facilities at JAG-ONE.
For sure.
I haven't slept well thinking about the mom who thinks that her 13-year-old kid is going to go into pro soccer, because they were typically the most tyrannical people in my practice as far as trying to decide which way something should go when they had no medical background at all. I dread the day of the high school agent, because it's coming, and it's coming fast. And I mean, you see, my daughter goes to University of Alabama, and that kid, the quarterback, got $1 million before he set foot on the field for the first thing. And now this year, there's a bunch of weird things that happen with people signing. That one football player was signed with Florida State, and then ended up switching after he committed to the team that Deion Sanders is the coach for. So again, like, nobody said anything, but I can't imagine why you would switch from a Division I school that you committed to an unranked school, that unless there was some carrot that was waved on the end of that stick. So I definitely am not looking forward to that, because it starts to put money into something that was supposed to be really looking out for the best interest of the player. And sometimes the people who are handling the money aren't looking at that. They're looking at what they can get out of this kid.
Guys, we are out of time, so I just want to say this has been the Seaview Ortho Podcast. A super, super huge special thank you to today's guest, U.S. Men's National Team legend and National Soccer Hall of Famer Tab Ramos, the president and CEO of Jag-ONE Physical Therapy, John Galluci Jr., and Dr. Sunil Thacker of Seaview Orthopedics. You can book an appointment online with Dr. Thacker today at SeaviewOrtho.com. Be sure to follow us on Instagram at Seaview Ortho, and like us on Facebook for updates on upcoming episodes. You never know, John, we might have to do a follow-up to this one. Get up, get moving, and get back to quality living with Seaview Orthopedics.